Hi, I'm Adam Searing. I'm the director here at the North Carolina Justice Center's Health Access Coalition, and we thought we'd do something a little different this week. We are interested in doing a short video commentary about some of the issues in healthcare that have been happening over the past week here in North Carolina and nationally. Thought it might be kind of fun. I write a lot on the newsletter and blogs that many people read, but video would be nice. Now, I don't chunk my emails like the governor, and I do know how to cut a computer on, unlike Franklin Freeman. So hopefully it won't be too hard. So let's go ahead and get started. Now, topic for healthcare commentary this week is going to be healthcare costs. And there have been a lot of news this week going on about healthcare costs, but let me clear up a few misconceptions that people have. The first one really is that healthcare costs are being driven by people eating too many cheeseburgers. Well, look, that's just simply not correct. We know that healthcare costs, and most health policy analysts agree, are mainly driven by overuse of medical technology, procedures, and drugs. And that overuse contributes to billions in healthcare costs, and you and me paying a lot more in health premiums than anyone else does in the entire world. Let's go ahead and think about one of those drivers. In the news this week, the drug Vitorin. Sounds kind of like some sort of a bird of prey or something, but it's actually a drug that's supposed to reduce your risk of heart attack. It's been used for years. The companies Merck and Schering-Plough, which have gotten approval to sell this drug and a related drug, have made over $5 billion. That's billion with a B, selling this drug instead of older tried and true heart drugs. Now, turns out, there was a major cardiology conference and they announced, along with the New England Journal of Medicine, that those drugs don't work at all. They are no more effective, in fact are less effective than older drugs that are far cheaper. This is outrageous. Not only are the companies accused of delaying the results of the study that showed these findings, but in addition, over a year ago, Consumer Reports at their website, Consumer Reports bestbuydrugs.com, where they compare the effectiveness of drugs and give recommendations, which many states, not North Carolina, but many other states do follow, was recommending not using these very expensive drugs because there was little or no evidence they actually worked. Now we know they don't work, and not only do we know they don't work, they could actually be harmful. Heck, this is crazy. I think I saw in a news story that even John McCain is using these drugs, Vitorin, but he shouldn't be. They don't work, and we're spending a lot of money. That means higher health premiums for you and me. Let's give some more examples that have come out this week. A lot of it's coming out of the same cardiology conference. There was a big front page story in USA Today. Now, I'm not usually a big USA Today fan, but boy, did they hit this this story right. It was about angioplasty. You know, that's when they go in, open up your heart, and stick more arteries on your heart to improve the blood flow. It's supposed to help prevent heart attacks, sometimes deal with chest pain. Turns out it's being done way too much. We're spending tens of thousands of dollars individually on this procedure when we really should be restricting when we do that procedure. Finally, there was a story just this morning about these crazy home defibrillators. These are the machines that they put on your chest and boom, they shock your heart. Well, turns out that there was finally a big study of whether these things work. They've been sold without a prescription since 1994, so for 4 years. And what's happened? They don't work any better than your neighbor who's next door. When he has a heart attack, he calls 911. The EMS guys come and they save him. So look, we're spending billions of dollars on these things. What can we do about it? Well, let me put a cautionary note into your thinking. We can't just immediately change everything. One person's cost savings is another person's big fat salary and profits. And the people and industries and drug companies who are making all this money are pouring it into our political system in campaign donations and in advertising and in fancy high-priced lobbyists. So that is, every time you talk about cost savings, they're going to be up there yelling about how we can't do this, we can't do that. Well, here's my proposal, and it's not a new one. Let's have an independent institute that can evaluate these things well before we start spending billions of dollars in excess healthcare premiums on these new untried and untested procedures. Let's see if they work any better than what we have, the treatments we have already. Doesn't seem like rocket science. In fact, in North Carolina, we've got some of the best universities, ECU, UNC, Duke, and Wake Forest, who have been doing this kind of research for years. We could jumpstart their efforts, establish a state and even a national institute with state and federal funding that could start doing these evaluations. It would save us all billions of dollars. Sure, there'll be some losers in the healthcare system, but I tell you what, I'd rather my premiums go down and I get decent health care than I'm overpaying for some crazy drug or some crazy medical procedure that I don't even need. That's the Healthcare Minute. I'm Adam Searing.